I have one frown line between my brows. How can I take care of it before it gets deeper? I'd like to take care of it before it gets deeper. I would like to use as little Botox as possible, as I am not a fan of the frozen look. How many cc's would be enough? If I was to get a filler to fill in my small line, how much of that would you recommend?
Thank you for your question. You've submitted two photos of a frown line, and you describe in your question that you have this single line or furrow, and you want to know about Botox, how many cc's you would need. You state in your question that you're not a fan of the frozen look, and you were also asking whether or not, if filler was necessary, how much would you need. Now, this is something that is always an interesting question, because a lot of people, and not from lack of encouragement by practitioners who sell the procedures as commodities, uh, it's very understandable why you'd want to know these numbers. To give you an idea of who I am and what I do, I'm a board-certified cosmetic surgeon. I've been practicing in Manhattan and Long Island for over 20 years. As a cosmetic oculofacial plastic surgeon, that means I'm a fellowship trained through through the American Society of Ophthalmic Plastic Surgery. I was one of the first doctors to use Botox, because originally Botox was not intended for cosmetic reasons. It was used for medical reasons, for conditions called blepharospasm and hemifacial spasm. So I'm very familiar with Botox. And once the cosmetic indications became popularized, suddenly it became a real free-for-all, and people were advertising X dollars for this many units. And what essentially has happened is the market became segmented. There were people who were shopping for price and getting low prices, but they weren't getting this good quality continuity of care. And then there were people who were paying very high amounts by a select small group of doctors who charged a premium. And of course, the consumer, the individual patient who's doing research, wonders how do they figure out what to do. Well, my own practice philosophy is that I never offer a procedure as an isolated commodity. So if someone calls us and asks how much you charge for Botox, what we try to do, explain, is it depends on, we have to do an assessment. We have to figure out whether or not it's right for you, and then we figure out how much you need and then what to expect. Our practice is more of a high-end practice, and so we have long-standing relationships with our patients, and we figure out with them what the ideal dose is. In terms of Botox, just to answer your question about the cc's, it's not measured in cc's, it's measured in units. And how a doctor dilutes the Botox and places those units all have an impact on the final result. In general, broad strokes, 25 to 50 units can be used to reduce the action of the corrugator and procerus muscle responsible for the frown line. If the treatment is done consistently, eventually those muscles relax enough to the point where the line gets softer and softer. In terms of fillers, it's very important that you be careful in this area. There are a lot of important vessels in this area, and there have been reports of skin loss. So it also is very technique dependent and experience dependent. So in my practice, we've used hyaluronic acid fillers. We've also used combinations of hyaluronic acid fillers with platelet-rich plasma. Platelet-rich plasma is derived from your own blood, and it helps stimulate your body's own collagen. We have found that there's a great synergy between the use of PRP, or platelet-rich plasma, with hyaluronic acid filler. So when you are exploring this option, it's very important that you be comfortable. I think that that's kind of for me, the golden rule is you treat patients like your own family, and you give them the time and the analysis, and of course with that comes appropriate care and an investment. It doesn't not this none of this stuff is inexpensive, but when people start shopping price, they invariably spend more, get less, and eventually just keep doctor hopping. So, as far as the frozen look is concerned, I can tell you that this one area being treated will not result in any way create a frozen look that is stereotypically illustrated on TV shows of the person who's over Botoxed. This muscle gets a lot of activity in a lot of people, and relaxing this muscle can really make a nice impact. It can really open up the eyes and open up the face. So I think you should meet with qualified, experienced doctors who you feel comfortable with, and I think that my suggestion will be valuable to you if that's what, if this makes sense to you. So I hope that was helpful. I wish you the best of luck. And thank you for your question.